Hi everyone, this is Dr. Neha. So, welcome to another new episode, which is Super 5 MCQs. With the FMG exams and NEET PG and NICT round the corner, I thought I'll start a new series, which is Super 5 MCQs for FMG and NICT. This is the first part for our FMG exams, Super 5 MCQs. Okay, so let's have a look at this MCQs. Also, I'm Dr. Neha. You can follow my lectures on my Unacademy profile also. So the first question, maximum number of work hours per week prescribed under Factories Act including overtime is. This is a very important question. 42 hours per week, 48 hours per week, 59 hours per week or 60 hours per week. So this says including overtime. Including overtime mein the answer is 60 hours per week. We all know what could be the questions asked over here. When was Factory Act launched? So that was launched in 1948 only, and over here the working hours other than overtime, maximum working hours over here, if we see maximum working hours, guys, it is 48 hours per week. But if we include overtime, including overtime, okay, including overtime, these hours become 60 hours per week. All right, including overtime it is 60 hours per week, or ऐसे in a day it is 9 hours per day the person has to work. But if it is an adolescent of age group 15 to 18 years can be employed, but they have to work 4.5 hours only, anytime between 6 a.m. to 7 p.m. They work only 4.5 hours. So any of this MCQ can come in your exam. Factories Act में what is the maximum working hours? 48 hours per week, but overtime मिला के it is 60 hours per week. And adolescents 15 to 18 years के 4.5 hours per week. Alright, so this is one of the most important questions that can come in your entrance exams. Now let us see the next one. A female brought her 16-month-old child to the OPD for routine immunization. Alright, the okay, yes, it's a boy. So he has been adequately immunized until now. 16-month-old hai, adequately immunized hai. He has also received a measles during an SIA drive, which is supplementary immunization activity, a few months back. What will you administer now? So here I'm trying to ask you that 16 months ka hai, tab tak till 16 months the child is adequately immunized, and the child has come for his immunization at 16 months. Before that he's been adequately immunized. So if anybody asks you what are the vaccines do we give when the child is between 16 to 24 months, guys, we give measles rubella vaccine, which is the second dose of measles in the form of measles rubella. Japanese encephalitis vaccine देते हैं. Vitamin A तो पिला ही रहे होते हैं. Anything else we give OPV का booster, and we also give DPT booster first dose. Okay, DPT booster 1. So this is what is given between 16 to 24 months. Alright, now here what it is saying additional, that during an SIA drive he has been vaccinated a few months back. Now SIA rounds are not replacement rounds, they are supplementary rounds. So it was a few days back, so gap between any two doses of measles vaccine has to be 28 days. So since it says the child has been vaccinated a few months back, मतलब वो gap अभी 28 days cross हो गया. So you can again at 16 months give the routine dose. So let's see, OPV booster, DPT booster, vitamin A. Yes, you can give, but if you look at option B, OPV booster, DPT booster, second dose of measles in the form of MR, JE vaccine, vitamin A. What is this one? OPV booster, DPT booster, JE vaccine and vitamin A. And option D is OPV booster, DPT booster, MR and vitamin A. So out of this, which is the best one? Option B. Option B में अभी मैंने आपको बताया measles को आप दे सकते हो in the form of MR vaccine. आप जापानीज एनकेफेलाइटिस वैक्सीन दे सकते हो, विटामिन ए, OPV1 and DPT booster. Please remember, this is not a question of delayed immunization. It is simply a question of that a child is due for vaccination at 16 months. What all can we give? In case it was a question of delayed immunization, guys, अगर मान लो ये question होता delayed immunization का, तो delayed immunization में BCG can be given up to 1 year. If you talk about rotavirus vaccine, if you talk about pneumococcal vaccine, if you talk about fractionated IPV vaccine, if you talk about pentavalent vaccine, ये सारे हम 1 साल तक दे सकते हैं. Other than this, if you talk about measles, if you talk about measles rubella, if you talk about oral polio vaccine, you can give them up to 5 years. Okay. If you talk about HIV, you can give up to 6 years. If you talk about Japanese encephalitis in case of delayed immunization, 15 years. And TD vaccine is given till 16 years. Ideally, TD vaccine आप lifelong भी दे सकते हो. So that is a question of delayed immunization. That is a different thing. But here the question was routine 16 months में आप क्या क्या दे पाओगे. Got it? Alright. Next important of the Super 5 MCQs. Family which lags behind rest of the community. For our FMG exams, this is very important. Is it communal, elementary, problem or broken? So family which lags behind is a problem family. Alright, which lags behind matlab the physiological needs, the basic needs of the family is not fulfilled. Okay, it simply means basic needs of the family is not being fulfilled. ठीक है, इसका मतलब है basic needs of the family is not being fulfilled. Broken family होता है जहाँ either parent, alright, where either parent is is dead, all right, or the couple is divorced, okay, or they are separated. So that is a broken family. What is a elementary family? It's a nuclear family, all right. So it is a couple with their dependent children. So it's a nuclear family. Communal family is where the roles and responsibilities of the family members, are divided. Okay, roles and responsibilities of the family members are distributed. So very important is problem family. एक और family होता है guys, dysfunctional family. Dysfunctional family मतलब क्या होता है? It is a family, you know, where there is some form of verbal abuse or domestic violence or something. So rest of the family members are fine with it. Rest of the family members are fine with the violence in the family. Okay, members are fine with violence and aggression in the family. Violence / aggression which is happening in the family. Are you understanding? That is dysfunctional. Elementary is nuclear family, papa, mama and the children while they are dependent. If it's a newly married couple, all right, that is also an elementary family. They are not putting up with the in-laws. So very important question this was. Next, what is population attributable risk? Risk of difference disease among exposed compared to non-exposed. Difference in risk of exposed and non-exposed. Estimate of amount of disease that can be reduced if risk factors modified or eliminated. Extent to which disease can be attributed. So if you look at this one, risk of disease among exposed and non-exposed, this is relative risk. You are calculating population attributable risk in a cohort study. ठीक है. Difference in risk of exposed and non-exposed क्या होता है? So if I say this is attributable risk, incidence exposed minus incidence non-exposed divided by incidence exposed into 100. So difference in risk, that means suppose it comes out to be 70%. We are studying smoking and lung cancer. It comes out to be 70%. So I can say 75% of lung cancer cases is attributed to smoking. That is the difference. Now, if you look at option C, option D, extent to which disease can be attributed to risk factor under study is attributable risk. अगर आप ऑप्शन सी देखते हो, estimate of amount of disease that can be reduced if the risk factor is modified or eliminated everyone, this is population attributable risk. Population attributable risk is incidence among total population minus incidence among non-exposed divided by incidence among total population, multiply it with 100. That means suppose we are trying to study the association population of smoking and lung cancer, it comes out to be 80%. So if we modify or if we eliminate smoking as a risk factor, there will be 80% reduction in annual incidence of lung cancer cases. So that is what is population attributable risk. This is more important to our policy makers. ठीक है, अगर हमें कुछ नई पॉलिसी लानी है, it becomes more important to that. Most commonly used measure of strength of association is relative risk, but for policy makers it is population attributable risk. Got it? Okay. Last Super 5 MCQ. All of the following are true about ASHA workers except she is trained for a period of 21 days, works with Village Health and Sanitation Committee, acts as a depot holder of IFA ORS. She is in the age group of 25 to 45 years. So what is correct about ASHA workers? She is in the age group, yes. She is married. All right, she could be married, she could be divorced, she could be separated, but she is a member of that community. She is a resident of that community. All right, she is a resident of that community, which is very, very important. Okay, so she fulfills which principle of primary health care? She fulfills community participation of primary health care. ठीक है, community participation. She works with Village Health, Nutrition, Sanitation Committee, yes. She acts as a depot holder for IFA ORS, yes. She also acts as a depot holder for chloroquine tablets, okay. ORS हो गया, IFA हो गया, home based UPT kits. So I'll just write over here chloroquine tabs, ठीक है, home based UPT kits. Home based UPT kits are निश्चय, all right, that she carries with her. Paracetamol for minor ailments. So she is a training period of 21 days. No, it is 23 days training period. So some points about ASHA worker. She is a resident of the community, 25 to 45 years, married, divorced, separated. All right, she is selected by whom? She is selected by the village panchayat, everybody. Village panchayat under supervision of our medical officer. Okay, this is the first point. Who provides her training? She is trained by ANM and Anganwadi worker. Training period is 23 days. All right. She is accountable to the village panchayat. All right. Then for what population do we have an ASHA worker? Population 1 per 1000 population. This is the existing norm. All right, this is the existing norm. But if we talk about the proposed norm, everybody, what is the proposed norm? Proposed norm is 2 per 1000 population. These are some of the questions that you must know. She is also fulfilling the principle of primary health care, which is community participation. Is it clear, everyone? These were some very important points about ASHA workers. She is basically the mobilizer. She mobilizes the children for immunization, pregnant females for हॉस्पिटल डिलीवरीज और राइट कपल्स को फैमिली प्लानिंग के लिए मोबिलाइज करती है. सो दीज आर हर रोल्स. सो दिस वाज द फर्स्ट पार्ट ऑफ अ सुपर 5 MCQs फॉर FMG. वेरी सून आई विल आल्सो पुट आउट वीडियोस फॉर सुपर 5 MCQs फॉर INI-CT. I hope you enjoyed it, guys. There is just a little update. NEET PG Combat is happening on 10th of October at 11 AM. So if you want, you must enroll in it. Okay, you can use my code PSM10. It is absolutely free, and you can win these amazing scholarships. 1 year NEET PG plus subscription absolutely free for 1 to 3 rank holders. 200 rank holders तक 25% scholarship मिलेगा. Every day morning I am taking free classes at 9 AM, guys. All right, and that right now we are doing last minute revision for our FMG students. So please don't forget to attend this 9 AM class, and 12 PM I am taking free classes for INI-CT students, which is on Tuesday. It's happening on Tuesday. It's happening on Thursdays, and it's happening on Saturdays, everyone. Please remember this. This is very important. You will get notifications also. Some of the batches which are starting: FMG batch, Mission INI, CT batch, Niche PG 22 batch, and clinical case discussion and instrument batch for a 4th year student. You can enroll and you can use PSM 10 and get a 10% off. And now the additional feature is raise a hand, where you can ask, you can talk directly with your educators and ask your doubt. So thank you so much, guys, and do let me know in the comment section if you appreciate such sessions. I'll be conducting them more often. Thank you so much, and best wishes.